Okay, we are live. My friends, I keep beginning these sessions with noting the extreme privilege that we have to be putting on this programming for you. And today is incredibly near and dear to my heart, both for the team that we are hosting and also for the theme of the day that we are entering into together. So we are arriving into day 4 of Health Equity Week of Action. And our theme for the day is standing up to tyranny. We talk human rights violations, state violence. We talk anti-ICE building movement against anti-ICE. We talk about genocide. We talk about the things that sometimes get siloed in corners and that future physicians don't often have a space to speak out against. One of the things we're hoping here at AMSA is that we can be a safe place for you to engage in that inherent humanity that is within you. If you are having a strong reaction to what is happening in the world, you are human. And oftentimes the institution of medicine, and they're not alone, will force us to capitulate and to silence the very views and the values that we hold dear, that make us who we are, that brought us to this field to care for people. And how can you care for people when they are being terrorized? So we believe it is our duty to not only uplift our own work and work towards building coalitions that can respond to these threats to our democracy and to our people, to our families, to our communities, but also to build allyships with other groups that are doing this work and that have been doing this work. And so due to that, I am again so privileged to be introducing to you the team at Health in Partnership. We have the lovely Christine, Renee, Stephanie, and Rebecca. This group, my friends, I will place the website in the chat for you to look over a little bit now, but mostly later, so you can stay attuned. The series that they are putting on, that they have just actually completed here on Monday, is on immigration justice as public health. Clear language, which is something that we are working to uphold in our initiatives as well. There's no beating around the bush. We are fighting for humanity, and we are letting you know where we stand. This team of incredible public health leaders work at the intersection of abolition, health equity, community health. They work on replacing punishment and policing with care, accountability, and systemic healing. Through the Health Instead of Partnership or Punishment Project, the organization supports efforts to build capacity across the health sector to end carceral harm and advance liberatory, people-centered approaches to safety and well-being. Very close to our mission and values here at AMSA. We are so thrilled to host you today. Each of you, thank you so much for the solidarity that you have formed in our communities across states lines and across international borders. You have brought together people of all disciplines. You have uplifted the work of abolition. And we hope that this is the beginning of what will be a long relationship with you. So without further ado, let's build a future where health means freedom, which is your mission, and it's definitely ours as well. So thank you so much. I'll pass the baton.
Thank you for that beautiful welcome this morning. My colleagues at HIP and I are in such solidarity with the work that you're doing. The words that you speak motivate and inspire us to keep doing this work. So just thank you so much for setting the tone and naming the alignment that we have together. Very happy to talk to you about immigration justice. My colleagues, Christine and Renee, have been in this space and have been doing this work. And actually, it's an honor and a privilege for my colleague Rebecca and I to be supporting these efforts. Just want to have some invitations for how we're going to be in this space with our shared voices. We're going to honor confidentiality, and we're going to accept non-closure. Like, we are going to start some conversations. We hope you think about these things. We hope you ponder them. We hope that you have conversations with your peers and your colleagues and your mentors and younger folks who are thinking about being in medicine. We hope this conversation continues and that you feel equipped to ask deeper questions, ask better questions, and like just be very curious as you explore. I want to give you the flow of today. We don't have a lot of time together. I promise you we could talk for a long time. And today we're not. We're going to have some opening and grounding. We're going to introduce you to some of our resources, and then we're going to talk about next steps as we close our time today. Again, even though it's just an hour, it's a good time to get inspired, get excited, to get our innovator gears going. So very happy that we have the time that we do. And now I'd like to pass it to my colleague, Rebecca, to begin how we begin all spaces.
Thank you so much, Stephanie. It's really lovely to be here with you all. Thank you so much for the warm welcome and invitation to join you today. We always open our spaces with an acknowledgement of the land, labor, and people. And so as we gather here in this virtual space, we recognize and honor that we are all also grounded in a physical place and space. I am located on Dakota land in Minneapolis, Minnesota. And this land that we occupy has been here long before us and will continue long after us. We open our work together with an acknowledgement of this land and the original people who lived and stewarded the places we live. The U.S. occupies stolen land and was built by stolen labor. All of us here in the U.S. reside on occupied lands of Native peoples. I invite us all to take a moment to acknowledge all Indigenous people who have continued to make this land their home. Also, the U.S. was built on the forced labor and stolen lives of enslaved Africans. I invite us to acknowledge and lift up all the people who unwillingly and forcibly gave of their labor and lives to the development of what we now know as the U.S. And we acknowledge and lift up all of their descendants and all those who continue to fight for freedom and justice across this country. Our work today and always is in solidarity with all Indigenous people, Black people, people of color, freedom fighters, community builders, dream makers, caretakers here and across the globe. Thank you so much for being here today.
Thank you, Rebecca. Hi, everyone. I'm Christine Mitchell. I use she, her, hers pronouns, and I'm the program director of our Health Instead of Punishment program at Health in Partnership. We want to take a moment this morning before we dive more into content to ground ourselves in the current political reality, as well as the histories that bring us to this point. We're actively witnessing state violence on a national scale. From the public executions of Alex Preddy, Renee Good, and Keith Porter Jr., to the reckless killings of Dr. Linda Davis and Nurul Amin Shah Alam, to the 7 reported deaths in ICE detention centers in 2026, with likely far more unreported, to the abduction of children and their families from their homes, schools, churches, healthcare settings, and immigration court appointments, to the state use of military, tear gas, pepper spray, stun grenades, and other chemical weapons against people defending their communities and exercising their right to protest. We've witnessed such state violence in LA, Chicago, Washington, D.C., and Minnesota, likely more to come. We understand what's happening as a pretext to occupy and build out police states, consolidate state power, and further entrench authoritarianism. And as we know, this type of state violence is not new, nor is it confined to immigration enforcement. It patterns itself after similar police executions and state repression of Black and brown people, trans people, queer people, and disabled people. It is a characteristic of the historical and ongoing violence of genocide, imperialism, chattel slavery, policing, imprisonment, white supremacy, and xenophobia that have been present in the U.S. since its very foundation. What we are experiencing today is inextricably linked with these oppressive systems. The slave patrols of the 18th century became our modern-day federal, state, and local police forces. Concentration camps like the one in Fort Snelling, Minnesota, that imprisoned thousands of Ho-Chunk and Dakota people became our modern-day immigration detention centers. The genocide of Indigenous people on this country's soil became the genocides that we are still aiding with our tax dollars in the US, in Palestine, and across the world. And this violence is happening not just to those that are targeted, but to all of us. It impacts all of our health. It harms our public health. Now I want to share with you all a video by Dr. Joelle Bervell talking about how this is a public health issue.
Agent in a medical exam room, but over the past few months, while working in the hospital, I've had multiple ICE agents sitting in the room while I talk to my patients. Not outside the hospital, not in the hallway, in the room. My name's Dr. Joelle, the Medical Mythbuster, and today let's talk about ICE, hospitals, and why this is becoming a public health issue. Twice in 1 week, I took care of patients transferred from ICE detention centers. In both times, ICE agents stayed in the room, listening, taking notes, even sometimes interjecting. That immediately raised concerns for me about privacy, consent, and the power dynamics at play, especially when language barriers were involved. So I looked into the law, but what I found wasn't clarity. There are clear protections for patient privacy under HIPAA. There are longstanding norms about hospitals being sensitive areas. But what I found is there's far less legal clarity when someone is already in federal custody and being given medical care. And ambiguity is where harm often lies. And unfortunately, this isn't isolated. Over the past few weeks, reporting out of Minnesota has documented ICE agents in hospitals, specifically in patient care areas. Doctors and nurses there are describing an environment where patients are delaying care, rationing medications, or avoiding the hospital altogether to avoid immigration enforcement. That's the moment this stops being a political debate and becomes a public health. Patients have to be safe enough to feel like they can literally divulge some of the most vulnerable information of their life. When enforcement enters that space, it fundamentally changes that interaction. And it doesn't just impact undocumented patients, it impacts everyone when we start to have to wonder whether care comes with consequences. So when we talk about ICE, we can't just limit conversations to borders or detention centers. We have to ask, what happens when enforcement enters spaces that are meant for healing? What does that do to already eroding trust, to outcomes, to those who feel safe enough to seek care at all? This isn't just about immigration policy. It's about whether healthcare remains a place of care, whether it becomes another site of surveillance.
Thank you, Steph. Yeah, and seeing folks reflecting the anger that evokes, that ICE has always transgressed those boundaries, has always stepped in to do harm. So amidst all of that context, that rage and anger and pain and grief that's evoked from us as we witness all of that. Amidst all of that, we chose to come together today to learn about what we could do together. And as much as this moment is a part of longer struggles, it's also part of lineages and legacies of resistance and collective care that have existed inside and outside of our government systems, but always with the leadership of community members and survivors of state violence. We draw strength from the lessons of the civil rights movement, the Black Panther Party's free breakfast programs and free health clinics, the Young Lords community-led detox programs. And in the face of this political moment, it has been so beautiful to watch networks of support, rapid response ICE watches, and community defense grow across the US. It's been so powerful to see those in Minnesota led by grassroots organizers, local business owners, and faith leaders, many of whom are BIPOC folks, immigrants, and women, building mutual aid efforts statewide to provide rent relief, food distribution, transportation, towing services, laundry services, and medical care. And we all have a part to play in this resistance. Our ultimate goal is the abolition of ICE, DHS, CBP, policing, prisons, jails, and detention centers. And there are small and tangible steps each of us here today can take towards that goal, which we're excited to share with you today. We're grateful that you're here, and I'll pass it to Renee to get into it.
Thank you. Thank you so much, Christine. My name is Renee Bedruzaman. I seem to be losing my voice at this moment, but we're going to make it through. I use she, her pronouns. I'm a project director on our health instead of punishment team. Thank you so much for having us again. Really grateful to be with you all and in community. I'm going to share a little bit about the evidence that immigration justice is a public health issue. So this is the data, the research we pulled to create our public health action guide. And so we'll share a little bit of the research and what those steps are in the guide. The research on immigration detention are that people in detention experience extreme medical neglect, inadequate care, mental health deterioration, and trauma from isolation, solitary confinement, and blatant abuse. The length of time that someone is detained matters, with longer periods of time in immigration detention associated with increased anxiety, depression, and PTSD symptoms. Furthermore, detention spreads infectious diseases and worsens chronic health conditions due to poor living standards, overcrowding, medical neglect, and inadequate sanitation. They're absolutely terrible places. We also have research on how deportation impacts health. So regardless of one's immigration status, the deportation of a friend, a relative, a neighbor, someone you know, is associated with increased odds of having to seek support for mental health. It really impacts all of our mental health. Studies show that increased risk of worse birth outcomes, such as reductions in prenatal care, low birth weight, and preterm birth among mothers after an ICE activity. And also the threat and fear of deportation itself is harmful to people's physical and mental health, which has shown to increase their stress and cardiovascular risks, impact emotional well-being, and contribute to negative health states and symptoms like PTSD in children. So we know that the research for detention and deportation is bad, harms our health, harms the public's health. We also want to uplift that keeping families together and keeping communities together has evidence for its positive impacts on health. One study found that participants reported fewer physical, psychological, and overall symptoms of stress, as well as a greater likelihood of excellent overall general health after being released for immigration detention compared to when they were detained. And then that social support attained by keeping families together, keeping communities together, is important for alleviating stress related to immigration, including ensuring access to housing and healthcare, transportation, employment, and school. All of those social determinants of health, all of those factors that we know keep families well, keep communities well, is important. So I want to go over some of the action steps for that are in our immigration justice guide. And this work builds on some previous work of Public Health Awakened, which is HIP's organizing group. There was a work group of members that came together in 2017 and during the first Trump administration and really challenged these anti-immigration and reactionary policies and work together with immigrant justice groups to create these action steps. This year, we updated it, refreshed it, and includes 10 actions that health departments or health agencies can take to respond to this very urgent moment. And this guide highlights examples from health agencies, hospital systems, and community organizations. So what is in our guide? The Immigration Action Guide includes first, rejecting 287G agreements and supporting cities, counties, and states to pledge to provide sanctuary to immigrant residents. And for those of you who are not familiar with 287G agreements, those are contractual agreements with local, city, and county law enforcement and federal ICE, Immigration and Customs Enforcement. And what it really does is it deputizes police officers to act as immigration enforcement. So we want to reject any of those contracts. And there are lots of information that shows if your local jurisdiction is in one of these contracts. And we want to uplift and support sanctuary to protect our immigrant residents. 2, preventing ICE and law enforcement surveillance and enforcement in healthcare settings. As we heard from in the grounding in the political moment by Dr. Joel, and as maybe some of you are experiencing in your hospital settings, that ICE is in the room, and we want to do as much as we can to prevent their presence, as well as their overall surveillance within that relationship, that doctor-patient relationship. 3, working with advocates to interrupting and reducing the harms of immigration detention means using your voice, using your medical student voice, your humanity, right, to provide an evidence-based testimony and to communicate how family separation, detention, and deportation harms health. 4, continuing to promote health agency policies that provide services to all people and to ensure that all people understand that they're welcome at the agency. So by this, we mean like know your rights information. And then and Adanya mentioned that there will be a Know Your Rights presentation later. I'm really excited for you all to engage in that. And then when it's also provided to your patients, your clients, ensuring that they're in accessible languages, culturally appropriate, in culturally appropriate ways is really important. 5, advocating that local and state governments create legal defense and community defense funds for immigrant residents is also a really great strategy and action to take. By this, you can support educating lawmakers and by advocating for these types of funds as a public health intervention, ensuring that we have legal representation in the courts of law is really important and people have access to that. And you can also think about contributing non-monetary resources like data or meeting space to support legal clinics can be an example of ways you can take action. And I should say there are examples in all of our action steps in the resource as well. And 6, connecting with immigration justice community power building organizations to learn how your agency can support their work means creating accountability mechanisms with community organizations that can be like community consumer advisory boards or community advisory boards, or leveraging your relationship with administrators to support community priorities. That can mean like being the person on the inside, right? That community members can support or can rely on and can trust. Number 7, promoting transformative policy changes that address the priorities of immigrant communities and opposing those changes that harm our people. So oppose any anti-immigration policies and work in coalitions that resist cooperation with ICE. or what we mean by that. Number 8, encouraging and supporting the efforts of sister agencies in housing and protecting immigrants and their families. We talk a lot with public health agencies, so we talk about public health in relation to that. So this is very kind of like government focused, but it could also mean within a hospital setting, within an academic setting, working across your programs, your departments, to be able to resist, right, this deportation machine and protect immigrant residents as well. Oh, and particularly with housing, that means like protecting from landlord discrimination and harassment. Number 9, enacting policies that keep immigration enforcement out of the workplace and protect worker rights. Workers have rights, so we want to ensure that people know what those basic worker rights is and encouraging enforcement of those. That's easier said than done, but all of this is, and it's important that we can use all of the tools to protect our communities. And lastly, and we'll go a little bit more about the importance of this and some examples of this, of promoting a narrative of inclusion surrounding immigrants and immigrant justice. And so those are our 10 steps of action in our resource guide, including examples. And now I'm going to pass it to my colleague, Rebecca, to share some other examples of the ways public health has taken action.
Thanks so much, Renee. So we are already seeing, and have been for a while, public health agencies and practitioners and healthcare professionals already stepping up and taking action aligned with these recommendations from the guide. We have seen folks really using narrative and communication strategies to declare deportations, public health emergencies, lifting up stories of the impacts on immigrant communities and families and the broader community. We've also seen folks taking on organizing and advocacy actions and roles. Health professionals have organized demonstrations, particularly here in Minnesota. Health professionals organized demonstrations against the immigration detention centers and the poor medical care and services that are present there, similar to what Renee shared earlier, the evidence of the lack of care within those centers. Also, seeing public health folks advocating and amplifying actions and policies that really protect immigrant communities from food, housing, and economic insecurity that are also risks when immigration enforcement is present in our communities. So, for example, organizing for eviction moratoriums at the state and local level. Many folks are also stepping into safety and rapid response actions. So resisting efforts to broaden surveillance, limiting access to data and surveillance that are present within agencies and healthcare settings, offering Know Your Rights trainings and sharing Know Your Rights information with clients and community members, discussing amongst each other how to do this work privately in order to keep people safe. Health institutions and public health practitioners are also mobilizing data for action, demonstrating the health impacts of ICE and CBP tactics, detentions, deportation, and family separation, similar to what we've shared here today. We're also hearing about health agencies that are demonstrating the health impacts of the use of tear gas and chemical weapons in communities. And also offering data capacity to community organizations to really support and amplify their advocacy efforts. Public health institutions and healthcare settings are also leveraging their existing services to champion community health workers in this moment to support protection and safety within immigrant communities, and promoting immigration justice, providing mental health support to community members as well as to staff who are engaging in rapid response actions. And then partnerships are so critical in this moment as well, working in relationship, cross-agency, cross-professions, cross organizations, and with organizers and grassroots members in our communities to uplift this work, to deepen relationships, to do this together. We cannot do this alone. And so really stepping into deep partnerships and relationships with advocates, community groups, and other organizations to really use the collective as a place of support and power to take these actions.
Thank you, Rebecca. I wanted to dive a little bit deeper into that last action step that Renee brought up about promoting a narrative of inclusion for immigrants in the country and why that is so important to shape a transformative narrative. So I want to get a little bit more specific about what we mean by a transformative narrative here. So the first thing that we encourage folks to do as you're thinking about narrative on immigration is really disrupt this idea that there are, quote, good immigrants and, quote, bad immigrants. This really comes from a lot of the toxic and harmful rhetoric that we're hearing from people who are in positions of power right now, but has existed long before that. And so this is the idea that there are, quote, good immigrants who are folks who, you know, came through a legal process and contribute to the economy and pay taxes, versus, quote, bad immigrants who are people who are undocumented or maybe have done harm. And we see this a lot in rhetoric around, don't worry, we're only deporting people who are these, quote, bad immigrants. We're only targeting people who are these, quote, bad immigrants, which A, we know just isn't true. And B, we really want to disrupt that narrative and say that we support all immigrants. We support all immigration, and everyone should be receiving of inclusion and welcoming and belonging and community care and what we need to thrive and survive. Part of that also is avoiding criminalizing and othering terms, things like illegal or alien, which again, we're hearing a lot of that rhetoric now, and it has long existed. The second thing that we want to encourage folks to do in shaping a transformative narrative on immigration is to emphasize and examine the root causes of migration. So why are people immigrating to the US? And often those root causes are things like climate catastrophes in their home. Often it's US-backed wars that are driving people to immigrate. And so if we can look at those root causes of migration, emphasize those, and that is another way that we can contribute to really like humanizing people and understanding more kind of why people are immigrating. The third thing we want to encourage folks to do is always, always, always uplift the voices, stories, and experiences of immigrants, folks who are directly impacted by these systems, who are living with that kind of fear and terror and the harms of immigration enforcement, the harms of the toxic rhetoric that we're hearing, the harms of these of the harmful narratives that we're hearing. All of our work at HIP, we really make an effort to center the stories and experiences of folks who are directly impacted by the issues that we're working on. And so we encourage folks to be thinking about that as you're thinking about how to shape a narrative on immigration. And the fourth and fifth things kind of go hand in hand. So the fourth is we want to counter anti-immigration rhetoric and policies with the public health consequences or the health consequences of detention, deportation, and family separation. So those are all of the things that Renee shared when she was talking about the research. That's what's in our talking points document, which I've dropped in the chat. But we have a particular angle that we can bring. We have a particular tool that we can bring to this narrative by sharing the health consequences of these harmful systems. And then the flip of that is we want to promote narratives of freedom, of community safety, of health equity, and of interdependence. And those are really the positive narratives that we want to be sharing. So again, if you want to take a look at our talking points document, I dropped that in the chat. That document really outlines a lot of the research that exists. Thank you, Tanya, for dropping it again. A lot of the research that exists on the harms of these systems and also the health benefits of things like keeping communities together. We also want to share with all of you the importance as med students, the importance as physicians in training, physicians already, the power that you have when you show up in spaces to advocate for things. There is, you know, for better or worse, there is huge power in showing up to a rally, showing up to a press conference in a white coat. That white coat really transmits so much power. And we want to encourage you to use that power to transform these systems. So I want to share an example of a press conference that physicians in Minnesota put together shortly after the execution of Renee Good. We'll just show you a short clip of it here, but I'll also drop the link to the full press conference in the chat. It's about half an hour. This is a short clip, but again, it just really emphasizes the importance of physicians showing up in this struggle.
As a pediatrician working in the heart of downtown Minneapolis, and as a mom whose 10-year-old co-wrote this statement with me, I can attest firsthand that ICE enforcement in our communities is directly harming my patients and our kids. And to other parents watching these atrocities unfold in front of them in their communities, we should all be very, very concerned. Family separation is not a temporary disruption. It is a traumatic event with lifelong consequences. And for Renee Good's children, I know other parents are thinking about them. They deserve better too. To close, I have a message for Minnesota parents. Your pediatricians and all of us are doing every single thing that we can to mobilize. We're working to get kids life-saving care in their homes and in their communities. Your pediatricians are still here, and we're all in this together. I'm going to try this in Spanish. Estamos aquí para ustedes. Llámenos y trabajaremos juntos para conseguir la atención médica que necesitan, ya sea en su comunidad o en su casa. If I could say it in Somali, I would do that too. Nosotros, los pediatras, los médicos, estamos en la lucha. We are in the fight.
Thank you, Steph. I'll pass it over to Renee and Steph to lead us in some discussion.
Feel like I need a minute because every time I see the clips, I feel the things. As a mother, as a Black woman, as a colleague, as a person who has worked with community health workers that have done this work, it physically makes me ill that people are not experiencing peace and joy. And it's just hard sometimes to think about this is like the world that we're in. So sorry, I've seen this video and interview so many times, but I still get upset because I'm like, this is the reality that we're living in. And I'm also super excited that like you all are here and cared enough to show up to have these deep conversations. So thank you so much. I want to know how this is landing for you. Like, how are you feeling? I know you all are in science and medicine all the time. I just want to give you a minute to talk about how you're feeling in this moment. If you feel safe to come off mute or to put it in the chat, we welcome any reflections you have.
I'm happy to read reflections in the chat aloud if you feel comfortable. Or please do come off mute.
If it's helpful, we can pause the recording.
Oh, yeah, absolutely. Thank you.
Mhm.